This is my really good friend. I was going to say Susie Martinez. Now Susan Rabideau. Am I saying your last name
You're
correctly?
saying it right. Uh-huh.
Okay. And she did go through weight loss surgery. It was a horrific experience, which she's going to share with you. You should be able to see the slide that is her before and after. And then I'm going to mute guys because I have background noise, but we're recording and I'll listen in. So there you go. Just tell me when you want to change the slides and I'll show whatever's on there and you can navigate what you want to show and talk about. Okay?
Okay. Okay, that's fine. Thank you.
Uh-huh.
Well, hello, everybody. I thank you for letting me share my story with you. I know that we have a limited of time, so I'm trying to get this in all as much as I can. In 2017, I was diagnosed with a bowel problem. And the bowel problem led to me wanting to get weight loss surgery. I was almost at 400 pounds when I had decided to do this. I was working at the time. I couldn't continue working because of my bowel problem that I had. So my next step was to do the weight loss surgery. With this weight, I also got problems with my knees. So I had decided to do the weight loss surgery before I even wanted to even start with the weight loss procedure. I mean, do the weight loss procedure before I went into a knee replacement surgery. 2017, on the 5th of September, I went in to have, it's what pretty common weight loss surgery. Everything went well according to my doctor. That evening, you meet different people. I might be jumping all over here, guys, but I'm sorry. You meet different people prior to the surgery. So you get to know the certain people that are going to have the surgery the same time that you have it. So I have met other people. When I got out of my surgery, I had noticed that a lot of the people that I met were walking the halls. And I wasn't at the time. I wasn't feeling very well. I lifted up my shirt and I had seen my whole stomach was black. Didn't understand what the heck is going on. Called in for the nurses and doctors. I ended up starting to bleed inside. I had taken 2 blood transfusions at that point. The next day, the doctor came in and he said that sometimes this happens where the staples, when they do the surgery, sometimes they don't take to your stomach. I just kind of want to let you know that the 3 different ways they had explained to me the different surgeries. Denise, is it possible that you could put on the slide with the 3 different stomachs? Okay, so the first, if you see on the first one, that's what you call as a lap band. There's actually no cutting of the stomach. It's basically a band. They put saline in this band and it closes the large part of your stomach off. So you basically have a pouch about maybe 3 ounces. The second surgery is the vertical sleeve surgery, and that's when they take out 80% of your stomach, 80 to 85% of your stomach. So basically you have almost like a banana shaped stomach now. So you don't have the full stomach. The other one is called a Roux-en-Y surgery, where they actually disconnect your stomach from your intestines and they reroute everything. So they make a little pouch, but nothing goes into the large part of your stomach. There was a lot of, with that particular surgery, I decided not to get, for the fact that you could get what they call dumping syndrome. Dumping syndrome is actually when your blood pressure all of a sudden will drop to down into the 40s, which is very, very bad, but the blood sugar. So I opt off to that one. I opt off the band surgery for the fact that I had heard that the band slips sometimes. It could tear the stomach. So I opted out to get the sleeve. So when I had the sleeve surgery and I started to bleed, they told me that sometimes the staples do not hold the stomach. So I had a blood transfusion then. I was there for about a week at the hospital, came home for the weekend. I was not feeling well. Things got turned really bad. My temperature went up to 104, 106. Bad emergency situation. my husband took me up to the hospital, found out that the leakage that comes out of your stomach area actually is pretty much poisonous. You know, it goes into, it leaks out from the stomach area into your body. And what it did, it caused me to get an abscess. So they decided to take me back into surgery, and they put a drain in me. So I had a drain that actually was hooked up into my stomach, and everything was being pumped out of my stomach, which there's a pump in the wall at the hospital. It actually pumps it out of your stomach. I was there for a week, was in a lot of pain. Doctor came in one day, asked if I was ready to come home. Yeah, I'm ready to go home. I was really happy about it. The drainage was going to come out, and he said, we'll get one more CT scan to make sure. We got the CT scan. I was excited to go home, so I had called my husband. He came, and the doctor hadn't come back in yet. When he did come in, he did tell us that the leakage was very bad, that they were going to try to put in what they call a stomach stent, which is, if the last, yes, that one, Denise. This is what they call a gastric stent, actually. And the stent gets put down into your stomach. So what it will do is it will open up your stomach, and it will allow the stomach, inner part of the stomach, to heal. So they inserted that into me. It took about a week to get, because he was speaking with other doctors at another hospital regarding my case. Apparently he hadn't had these problems from doing these surgeries before, so I was a lucky one that it happened to. He then said if the stent did not work, they would have to do the complete bypass on me. That is the Roux ride, where they actually redo the plumbing of your stomach, which is not what I wanted to do. Yes, which is that right there. A week later, I go back into surgery. Mind you, I'm now maybe 6 weeks after my surgery, and I'm still in the hospital. I hadn't eaten or drinking anything by mouth. And they started giving me Percocet. But the Percocet, they decided they weren't going to give to me through my IV, that they were going to have me take it through the mouth. And it was making me sick. It was causing me to throw up. And when you have nothing in your stomach, it's more of a dry heave type, a little bit. At that time, my daughter was with me, and my husband. They had noticed there was a little blood in what I did throw up. At the time, it was brought up to the nurses, and they pretty much brushed that off and said it was probably something I ate. And I said, well, you should know that I haven't had anything by mouth in quite a long time. So they continued giving me this medication, against, even my husband was saying, quit giving her this, it's just making her sick. Came to the point where I got so sick, they took me back into a CT scan and realized that the stent they put into my stomach literally fell down deeper in through my digestive area. So now they have to pull this stent out. So I had gone back and forth into the surgery because the original drainage tube they put in me had stopped working. So they had to put another drain in to do that as well. When they went in, I was in ICU for a while after he put the stent in. I wasn't feeling well. I just was feeling really bad. And I told my daughter, you know, something's wrong. I threw up, and it was basically just a big blood clot that I had thrown up. And I was throwing up, I would say every 5 minutes, and it was nothing but blood, nothing but blood. The doctor came in. We had the doctors coming in. My vitals didn't change much, which was very strange to me because of the amount of blood I was losing. They said they were going to hold off. They were going to continue giving me my pain medication, but the 12 hours of throwing up blood, the doctor finally came in. He said, well, we're going to keep her. She'll be fine. We're going to just keep an eye on her vitals. Finally, the nurse change came in, and our nurse came in, and she took one look at me, and she said, no, this is not good. So the doctor finally came up. They took me to the CT scanner. Mind you, because of the amount of blood that I was losing, I was kind of going in and out of consciousness. When they wheeled me back in, I did hear my doctor speaking to my husband and to my daughter, saying that I needed to put, his words were, we need to put her down. And I'm thinking, okay, I'm dying, you know, this is not good. He actually intubated me. I was put on life support for 4 days. And he said it was for me to heal. So I was on life support for a few days. They took it out. I did feel 100%, you know, not throwing up anymore. I did a few times try to dry heave, and I was so nervous that, is there blood? Is there blood? I started hemorrhaging out through, which they had to put a central line in my neck because of all of the IVs that they had on me. It had blew all of the veins in my hand, in my arms. They even tried putting an IV in my foot, which didn't work. So they end up putting a central line in my neck. I'm not sure you guys know what that is, but it's basically an IV that they put through your main artery. And this is how they give you your pain medications or any other medications, because they couldn't find any veins anywhere else on my body. The night that I was bleeding, the blood was coming out of my drainage, my central line. It was coming out both of the drainage bags that I had. Through my vagina, I was bleeding. I was just bleeding out everywhere. So they basically, what they did, because it was so severe, they brought the operating room to the ICU room, and they cleared my room out, and I was intubated. Terrified that this was it. I wasn't going to make it. I said goodbye to my daughter and my husband, because in my thoughts, once you're intubated, that's the last resort. So after the fact that this was now, I'm in the hospital now for 2 months. They came in, I had a feeding tube put in through my nose because he didn't want anything going through my stomach at the time. This was in, I believe, in November. They came in, they pulled all of my tubes out, feeding tubes, drainage tubes. For the first time in almost 2 months, I had no more tubes coming out of me. I was feeling a lot better. Things were great. Came home, wasn't feeling well again. And I went back to the hospital, and I was told my stomach was still draining these bad things out of my stomach and into my system again. So here we went again. I had a drain put back into my system again. Back in the same hospital I was in. I was there for about, I guess, 4 days with another doctor, because my doctor was on vacation. And when my doctor came in, he said that apparently the reading was, the scan was read wrong, and I didn't need the drainage, but I was still scared to have the drainage taken out. So he sent me home with the drainage tube for about 2 weeks, and then I had it removed. Thought everything was going well after that. Come December, I was getting pains again, and went back to the doctors again and found out that with the tubings that were in my stomach for the drainage, they never closed. So the hole stayed open, and it caused a hernia in my stomach. So they had to put me back in the hospital, back into surgery. I went through almost 13 times being put under for this stomach surgery. At the end, I did lose 100 pounds. A lot of people say that this is an easy way out. This, to me, is not an easy way out. It's a tool to help you lose weight. But through my experience, I feel that if someone decides to do something, that they should really look in to all of the side effects that could happen. Personally, I still have different side effects. There's certain things that I still can't eat. You lose a lot of your nutrition by having the sleeve done. So you do have to wear, I wear what they call a vitamin patch. I don't know if you can see this. It's the patch that I wear every day. Instead of taking pills, vitamin pills every day. So I have to have this at all times. Since my surgery, my teeth have gotten worse. I've lost a few teeth. I would always suggest that you really look into who's doing your surgery. After finding out after the surgery that was done that 2 patients died after I was there for the same reasons. So I'm pretty much a lucky woman to have survived such a thing. Obesity runs very high in my family. I just lost my baby sister who was close to 600-700 pounds. I didn't want to get that way, and I felt this was my last resort. I would never recommend the surgery to anybody because this could happen to anybody. That's why I say look into who's doing the surgery, what the side effects are, because they don't tell you a lot of the side effects and the things that you can and cannot do. And unfortunately, because of the COVID, I've actually gained 19 pounds of the weight that I lost. And that's upsetting to me, but that could be also my fault. Even after the surgery, I still needed to get my knee done. It needed to be replaced. So that kind of took me on a downward fall there of healing with that. So, you know, with this kind of surgery, I just recommend that people really look into it and try other ways of losing weight. I know, Denise, that you lost a lot of weight from a different source. So I would just say, you know, to look into it a little bit further. My doctor seemed to be very fast. He wasn't very intuitive to me and my feelings and what was going on. So when we asked questions, it was just yes or no answers. So look into the doctors that you want to take care of you. Because, you know, there was other incidents that happened in this hospital. You have to understand the hospital that I was in is typically not a trauma hospital. It's a hospital for someone who's had a knee replacement or a broken bone or gallbladder surgeries that are just there for a day and then they're released. That's what happened to me. So thank God I'm still here, 19 pounds heavier than I was a year ago. But I don't know if you have any questions, if there's something that you'd like to ask.
I've never
Susie in the chat, I don't know if you can see it. Alana said a while back when you were first talking, it sounds like a malpractice lawsuit. So we'll ask you to address that. And then Alana also said, don't tell me that it was San Dimas where you were. She's in New York, Alana. Because her mom had the same experience that you had there, which was horrible. So, yeah, go ahead.
So what was the first question she asked again? I'm sorry.
It sounds like a malpractice lawsuit. So probably everybody in this room is thinking, is it a malpractice? Because if this gentleman had 2 other people die under his care, I don't know the statistics for this surgery. I would have to research it to find out, but it sounds like he doesn't have very good odds.
Right. Well, the thing is, when we questioned him, my husband was very upset for the fact that the first night I had a blood transfusion and they didn't explain to me what was exactly going on. So the next day my husband did ask the doctor, you know, why is she bleeding? Why is this happening? And everything that was told to us is you signed a lot of paperwork. And one of the pieces of paper is that, you know, the things that could happen during surgery. I mean, anybody could die in a very simple surgery, but I had to sign a piece of paper stating that I knew the risk. And that was his answer to my husband when my husband asked him, why is she bleeding? What's going on? You know, why is this happening? He goes, well, she signed the paperwork. She knew the odds and the risk that came with the surgery. So I could probably sue. Actually, before doing this presentation, I did some researching on weight loss surgeries that had gone wrong. And there was a lady that basically had the same thing that was going on with me. And she tried to sue that doctor. But again, because of the paperwork we signed, we knew what we were getting into and we knew what could happen. And unfortunately, he had claimed that I was the very first patient that this had ever happened to. But afterwards, I found out that wasn't true. We had noticed that this doctor was very, very like in your room and out your room. You know, it's like, wait a minute, don't leave. I have more questions. There was a lot of questions and a lot of questions that weren't answered. When he spoke to my daughter and my husband, who had to sign the paperwork to put me on life support, I forgot where I was going with this. When they had signed all of this, I guess he had other patients that he had to do this to, and we weren't told this. So that's why I suggest when people look into this, that they really need to look in the background of who is doing your surgery. I was just wanting to, I was at the point where I was getting so big. I was almost in a desperate way. He is the only one here close by me, which is 2 hours away, that does this surgery. The other one would be in Rochester, New York, which my husband was just about to fly me out to there because things weren't happening right here, you know. What's really sad with me right now is the fact that when you have the surgery, you have to go, they want to see you every year for a follow-up. They send you to the nutritionist, other people, they weigh you, you see your doctor. This doctor wanted to see me every week. Every time my husband would ask the doctor, are we going to lose her? Is she going to die? His first response was, we're going to try not to let her die. When my first visit came and I was telling him I was having this pain still, and that was from the hernia, he told my husband, she almost died. You know, he goes, I saved her. You know, she almost died. And we both kind of looked at each other because he comforted my husband and told my husband, don't worry, she's not going to die. She's not going to die. Until we got to our first follow-up is when he said, you know, you almost died on us. The thing that is really, to me, is bothersome right now is I am now 4 years out of the surgery, and not once has anybody from that hospital called for a follow-up. My doctor hasn't called me up to see how I was doing. The last time I spoke with him, unfortunately, another thing that I received, the Roux-en-Y surgery, is the one that I had decided not to get because of your blood sugar dropping so fast. And I developed that with the sleeve. And I was one of his first patients, he claims, that had the sleeve done and gets the sugar drop syndrome. And I deal with that maybe once every 2 months. And I could just be sitting and my blood sugar drops down to 40s, where I can't even get up off my chair. So there is a lot of side effects, and it does still continue with you years after the surgery. So, is there any more questions? I've not seen the chat. I don't know.
That's okay. Hang on really quick. If you click on the top where you see like a line, like a conversation square with lines, that would reveal the chat to you. But it's okay. I can reiterate what they're saying, and then Alana has a question.
Okay.
Well, I was actually going to tell you, I don't know if the laws are the same for you, because you said you were in New York, correct?
Correct.
Okay, because I know in California, you can only sue for malpractice within 6 months of whatever incident happened.
Mm-hmm.
Because it's really messed up. Yeah, but basically, so they're trying to say that, oh, you signed a thing saying that, oh, that you can't be blamed for side effects. But
Mm-hmm.
if since you had side effects that are not consistent with this surgery and they
Mm-hmm.
sent you home, you were internally bleeding when they sent you home, basically.
Yes,
That
I
is
was.
malpractice. And the fact that the doctor was not the one who addressed it, it was a nurse,
Mm-hmm.
that is also suit for malpractice because that doctor was not being consistent with treatment that he was
Mm-hmm.
supposed to be giving you. So you
Mm-hmm.
definitely have a case. And if I were, I'm just saying because my mom regrets not doing it because the same thing happened to her. They cut her intestine and sent her home. And she could have sued, and she had a central line, same as
Mm-hmm.
you. She had
Mm-hmm.
a transfusion. You know, she was on Dilaudid there for 2 months.
Ah, the
You
lauded,
know,
that was my famous word.
oh yeah, Dilaudid. Oh, she said, "Oh, I miss it." No, but no, you definitely have a case. And if I were you, I'd try to find an attorney because the way that you're saying, "Oh, he almost died, I saved her," that's them trying to cover up, what they did.
Right,
Because
right.
that's not supposed to happen with the weight loss surgery. That was definitely some kind of shady stuff. And because he wasn't transparent with you about
Mm-hmm.
prior, like how you were saying there were two other people who died, them not telling you that's illegal
But that
too.
was actually after my procedure. I had heard people had died.
Yeah, but he said you were his first, or
Yes.
see,
Yeah.
that's not being transparent. He could have his license revoked for that, or
Right,
not, yeah.
right.
So you definitely need to. I mean, even if you can't sue, report whatever doctor this was to the board,
Mm-hmm.
explain your situation because two more people die. That can be avoided if it continues happening. So I definitely think you should speak out about that.
I think I'll look into, after you have these surgeries, they have what they call support meetings where you could go to the hospital and people who have had the surgery. Sometimes it's to motivate people to, if they've gained weight, to try to motivate them to start to change your diet again. And there is a nurse there. And I did, I did tell people my story because some people that were there that were wanting to hear the stories of people who had the surgery. And I wasn't gonna lie. And I said, I'm scared. I'm sorry if I'm scaring any of anybody here at the meeting back then. I'm not trying to scare you of not having the surgery. I just want you to know what my experience was and what could happen. So after everybody left, the nurse did stop and talk to me, and she actually told me, you do have a case. And there wasn't even, a lot of it wasn't even about the surgery. There was things like needles that were left in my bed. My husband, I didn't even know. My husband had got me up one day and he says, "What is this needle?" It was a needle they put into your drainage bag to pull out the excess liquid. They left it in my bed. When I did my walk arounds, my daughter found pills on the floor. It just wasn't it. I would not ever recommend that hospital for one thing. We should have, been taken. My husband was very close in flying me out with a helicopter to go to another hospital because there was so many things that went wrong. The hardest part is, when you're laying there and you're bleeding out everywhere, and you really feel that this is it, saying goodbye to, your husband and your daughter, and all you can think about is, what did I do? What did I, why did I do this for cosmetic reasons? Because I didn't want to be obese like my sister, at this point. I mean, I'm healed. I still do I have the dumping syndromes, my teeth situation, the vitamins you lose. So there is a lot of side effects, down the years that still affect people when they have these surgeries. If I had to opt again, it would probably have been the band where there'd be no cutting whatsoever. It's basically a rubber band around your stomach. So I personally would never recommend a sleeve type surgery to anybody. I just you know, if it could happen to me, it could happen to anybody, you know. So.
Yeah, I think that this is such a rampant way that people choose to go that, you know, it's like you said, I lost a lot of weight. I chose to find a healthy way to eat. And all my
Right.
life, I sought out, how do you eat healthy so that your body's getting what it needs? You know, you hear all these different diets and stuff. And so I did find what I finally believe is that. And I did lose a lot of weight with it. And once you start going back and eating sugar and carbs and all that kind of stuff, you know, it's a lifetime of eating correctly. That is the only answer. But I know a lot of people who have had this surgery done and you know, have gained weight back, immense amounts of weight back, even though you have like a tiny stomach or you have nothing. It's still behavior modification that you have to practice in order to have the surgery be successful.
That's 100% right, Denise. That really is true, because I know that, and I'm not using the COVID. I would love to use the COVID as an excuse of why I've gained 19 pounds, but I can't, because it was me that was sitting here. It was me that was probably eating things that I shouldn't have been eating, because, you know, when you come out of the surgery, you want to eat right. You want to be very, you know, I thought corn tortillas was a good tortilla to eat. And with one of my follow-ups with my doctor, he says, corn tortillas, he goes, it's sugar. It's nothing but sugar. He goes, and I'm not doing another sleeve on you, you know, and excuse my language. My husband says, F no, you are not touching her anymore. You know, this is it. You're not touching her. So there, as you can see in the picture, I never ate, you know, right? Fortunately, I mean, Denise knows I've always been thin my whole life, you know, and once you have those children, the weight is very hard to come off, you know, and being my sister being as big as she was and losing her, I was seeing myself going that way, and it scared me. It scared me.
Do you guys have any questions for Susie or Suzanne? Sorry, we're at 109, so I don't want to keep you longer, Susie, than you know, any much longer if possible. And then if you guys have any questions, if you want to go ahead and ask them, so we can wrap up. Or comments, either one.
What this is. Nobody has no questions.
Okay, well, one thing I typed in the chat is really unlearning and relearning how to eat. I mean, we've all been taught the food pyramid, which is what I believe now and I've learned is wrong. It's truly learning what food is right and what food is wrong for you. I too, Susie, and I think everybody here will say that COVID has, you know, kind of sabotaged our eating, because I'm the same. It's, you know, stress eater, emotional. Food is stress. Food is emotional. It's a place where people go for comfort, right? In all different situations. Vast majority of people are in that situation. And that's why, truly why, the United States has such a hard time with COVID, because we have an obesity epidemic, and obesity is one of the worst things you can have if you have COVID, because COVID is an inflammatory disease, and obesity is already an inflammation in our bodies. So yeah, those go hand in hand. But I want to thank you so much for logging in and sharing with us. I think they learned a lot. I learned a lot. I knew a lot about your story, but I learned more today. So I truly appreciate you being here.
Thank you for asking me.
Yeah, could you guys unmute and say thank you, because she's not able to see the chat.
Thank you so
Thank you so much, Susie.
Thank you.
Oh, you guys are welcome.
Thank you.
You are so welcome, everybody. Thank you for letting me tell my story. Actually, this is the first presentation I've done in my whole life, and I'm 60 years old.
Well, we locked it in. We recorded you, so.
Okay. Locked in. Well, you guys have a nice sunny day, because it looks like you're having a great day over there. We got rain here today, so.
It's 80 here today.
Oh, I'm probably looking at maybe 60s today.
No. Come back. Well, I'll see you in June when you come back to Cali to see you.
Yeah, that'd be great. All right. Thank you, everybody.
Bye. Thank you very much.
You're welcome. Bye-bye.
I
have no idea how to log out of this.
Oh, you know what? If you just close the tab at the top, you'll log out.
Okay. All righty. Enjoy your donuts.